So I'm going to be going over Promethazine, aka Phenergan. We just wrote a protocol for it. We're doing mandatory training on this medication for a reason. So hopefully this will be a quick training, but also educational for you guys. The indication for this medication is going to be active vomiting. The way that this medication works is that it blocks a couple neurotransmitters, specifically histamine, dopamine, and ACH, all of which helps treat vomiting, and also it helps with motion sickness slash vertigo. I think it's important for you guys to have a basic understanding of how this medication works. Now, we've all given somebody Zofran, and we know that Zofran is not a great drug when somebody's actively vomiting. Zofran blocks serotonin receptors that are found in your GI tract. Now, I just said that promethazine blocks 3 neurotransmitters, being dopamine, histamine, and acetylcholine. So you can see that of the other 2 categories, it has at least one of those neurotransmitters in there, which is why promethazine is better at treating active vomiting, because it's hitting multiple sites, preventing them from stimulating that vomiting center. Now, side effects of promethazine, one of the big ones is basically that it does have some sedative effects to it, and that's going to be the main one. And you need to understand that, because if you're giving this medication in combination with an analgesic or a sedative medication, you could potentiate that medication. Now, it blocks histamine, very similar to Benadryl, and we know that when we give somebody Benadryl, we cause some mild sedation, make them a little confused, and make them a little drowsy. We also are blocking acetylcholine, like I said before. Now, when you give somebody atropine, that is what's blocking acetylcholine. So you have some anticholinergic side effects very similar to atropine, maybe not to the same effects as atropine, but you do still give the patient a dry mouth. They may get a little tachycardic, they may get some dilated pupils. It blocks dopamine, leading to extrapyramidal reactions. Now, this is very rare, but we're going to talk about it because it could happen to somebody. Okay, these extrapyramidal reactions that I'm going to cover today is dystonia reactions. So a dystonia reaction is basically an involuntary muscle contraction. It's basically like a spasm. Now, it doesn't mean that the whole body is spasming like a seizure. It just means specific areas of the body could be having a spasm. So it could be their eyes, it could be their neck, it could be their limbs, it could be their mouth, it could be their jaw. They could have trismus. It'd be very uncomfortable for the patient. And a lot of the times they've recently taken medications that block dopamine. Okay, so since promethazine does block dopamine, there is a chance that a patient could get a dystonia reaction. And the best treatment, if you do see this happening, is to give Benadryl. Benadryl will kind of help relax all the muscles in the body, and the patient will slowly start to improve. Need to be very cautious about is that this medication is not for somebody who's already altered and has a decreased level of consciousness. Remember, this medication causes a sedative effect to the patient. It can also lead to respiratory depression. So if you have anybody who's already struggling to breathe and you give them this medication and you sedate them, you might take away their respiratory drive. You need to be very cautious with giving narcotics with promethazine. Promethazine will potentiate the effects of your analgesic and sedative medications. So if you are going to give pain medications with promethazine, I would encourage you to start with lower doses. And I would just encourage you to give them the promethazine first. You may sedate them enough to where they don't feel the pain anymore, and you may not need to give the pain medication. And it's recommended, like I said, to give half of your normal dose of whatever pain medication you are trying to give the patient. And obviously place them on NSAID. Contraindication is going to be any pediatric patient. There is a black box warning for this medication for kids underneath 2. Black box warning just means a big safety warning that you should be concerned about. There were just studies showing that kids that got this medication when they were actively vomiting had a higher incidence of respiratory depression, leading to fatalities. And then any kid greater than 2 Should get the lowest effective dose possible and should only be used in cases where there's just prolonged vomiting and nothing else is working. But for us, as far as our protocols, you're not giving it for pediatric patients. Another contraindication is pregnancy patients. It's a category C, meaning that risk cannot be ruled out. There isn't any significant studies in pregnant women. Most of the studies have been in animals, and it could potentially cause harm. So do not give it to somebody who's pregnant. It's going to be very rare that you come across this, but if for some reason you run across a kid who has Ray's syndrome, you do not want to give this medication. So Ray's syndrome is basically a syndrome in which the patient just suddenly develops severe vomiting, tachypnea, low sugar, their liver starts to be affected, their mental status has an abrupt change, they go from being conscious to unconscious, they progress to a coma, and there's just a black box warning for giving Phenergan with Ray's syndrome. Because of the extrapyramidal reactions that come with Phenergan, it could mask and complicate the diagnosis of Ray's syndrome. The dose of this medication can be given IV and IM. You are going to have to dilute this medication in a 100 cc bag and give it over 5 to 10 minutes if you're giving it IV. According to Dr. Stevens, the safest way to give this medication is intramuscular. This medication, if not diluted, can cause tissue necrosis. By diluting it in a 100 cc bag, you are decreasing the chance of the medication causing tissue necrosis. And again, I will say this, Doc did say the safest way to give it is intramuscular. For somebody greater than 65 years old, the medication should be halved, meaning that your initial dose should be 6.25 milligrams diluted in a 100 cc bag, run over 5 to 10 minutes. You can repeat this one time. The same process can occur if you are giving the medication intramuscular as well. Please scan the QR code. It's just confirmation that you've watched the video, you understand the protocol, and that you know what to do and what not to do when giving this medication.